Okay, well, I'm really excited to have you guys here today, and we're going to go through. Do you guys know very much right now about GuruNanda?
Only a little bit. We have heard from you at Yankee Dental Conference.
Oh, yay! Awesome. Okay, I'm so excited. All right, so you know a little bit about our company, so I'm going to kind of go through this. Did my screen advance for you?
Yes.
Okay, awesome. So GuruNanda really is a company that's rooted in Ayurvedic practice, and it wants natural products that are high quality but affordable. And that is really a big key, is that we want affordable products that people can get accessible to, they can have accessible ability to. We are our number one retailer is Walmart. People can get it there. They can get it on our website. They can get it at many different retailers. You can even sometimes find our stuff at the dollar store. And that is a big thing is high quality products, but affordability. And we're going to talk a lot about that today. We're also going to talk about the Ayurvedic practice and kind of bringing Western and Eastern practices together. This is our CEO, Puninanda. If you don't know Dr. Fresh, he is a very big part of our company, and we're really proud of him. And he and his family have been really involved in dentistry for a long time and doing toothbrushes and just trying to really elevate oral care. And so we're really excited about him and how much he really loves being hands-on, boots on the ground in many of the uh, places that he is finding all of our products. So I want to tell you guys a little bit about that. We do have a retail site and a professional site. The professional site is more for our dental professionals and it's more cases of things. And you can't always find some of the stuff that we have of our wellness products, and those are on the retail site. So I'll tell you at the end, there's a little coupon code you guys can use that we can also get you. I'm going to give you guys some customized samples at the end. We'll talk about that, but because we weren't able to send out the samples yet, and that's our gift to you today for having us here. But we'll do that. But you guys can also get on our retail site and look at some of these other things like mouth tape. We're going to talk about MCT oil, but there's also an organic castor oil. We have a lot of really good products that I encourage you to go on our retail site to look at, but we're going to talk about the oral care today. So the oral care, one of the things we're known for is our oil pulling, and it is an Ayurvedic practice. And the Ayurvedic practice is that what is coming into our mouth affects our body. And isn't that beautiful? I mean, I'm an oral systemic speaker, national speaker, and that is my platform is that our body, our mouth affects our body and our body affects our mouth. And so I love that the Ayurvedic practice is really first thing in the morning on an empty stomach before they swallow, before they talk, before they do anything. People that are following the Ayurvedic practice want to make sure what's the toxins and the pathogens, and because of dry mouth and just the things that are accumulating in our mouth all night long is really not the best thing to be swallowing in the morning. And so they take and pull with oil. It's usually 20 to 30 minutes because they're using regular oil, but ours is fractionated, so it only takes 2 to 5 minutes. They swish it in their mouth and that oil starts to bind and hold pathogens. So then it can be spit in the trash. So the action of it is that it's lipid based, 100% lipid based. It grabs and holds toxins, similar to like your oil in your car that you have to change because it has gets particles in it and dust. Like when we think about salad dressing and you put spices in there and you shake it up, it can hold and grab particles. And then if you emulsify it, it really thickens and it actually really holds them. So we know oil has ability to hold and bind. So that's the part of the thing with swishing it around in your mouth. It also combines with saliva and creates what's called saponification, which is where it creates kind of a soapy-like substance to help to clean the surface and brighten the tooth. So we're really grateful for these oils that people have been using for centuries for to be able to use to help grab and hold those pathogens. And again, this is kind of thinking outside the box. Could this help our patients? And I'll tell you a little bit about that in a second. But we also, one thing about that makes our oils unique, they are fractionated, so they're always in a liquid state. But these oils are also, we have other essential oils in them for our oil pulling. And these essential oils have been used for decades in dentistry. And we also have vitamin D, E, and K2. So it can support and help with pH balancing. We're going to talk about xerostomia in a second, but oils do help with that. We have no alcohol in our products, no artificial colors or fragrances, and no GMOs. And there's no sodium lauryl sulfate. And most of our products do not have fluoride currently. We do have one product in Walmart that does have fluoride, but it is not available on our professional site, but you can send patients to get that anti-cavity GuruNanda rinse, and it is at Walmart. But we have science in our oil pulling. I challenge you to get on. We don't have a lot of time, so just go on our website and you guys can look and see. But we do have evidence, scientific evidence supporting antibacterial and helping with certain gram-negative positive bacteria. Coconut oils is great for inflammation, and we also have studies showing that 2 to 5 minutes swished with our oils, spit in the trash, that is beneficial as 20 to 30 minutes with regular oils that they traditionally use in Ayurvedic practice. We also, our oils come in a lot of different sizes and shapes. We have an 8-ounce that a lot of people like to buy here. The 8-ouncer works really well because it's a perfect size. We do have the 3 ounces for offices. And then we do have 2 oils. We have a children's oil. The children's oil is a berry. So anybody that doesn't like mint or cinnamon, which is this one here is ashwagandha, cinnamon, and neem. By the way, I have a good friend that is using, she's an oral health coach. So she does salivary testing, which really will be big in the next 5 years. She is using the ashwagandha, neem, and the Ceylon cinnamon, which is a high-grade cinnamon. She's finding it certain pathogenic bacteria. She's finding that this helps control. And so she's really excited about it. So there are things that we're getting more in the mainstream of dentistry. I think salivary testing is going to help, again, individualizing patient care so that we can treat people with what's actually benefiting them and not having them use something that may not be benefiting them at all. But we definitely have our oils. We're super excited about them. It's a pre-brush. You're going to brush, floss, and tongue scrape after, and we'll see all that in a second. The other thing oil does is it can lubricate. And for those who maybe are sensitive to some essential oils and they still want to pull with the oil for that cleaning, or people that actually need to use the oils regularly throughout the day to more hydrate, because oils clean or they hydrate, or both. But these oils right here are our oils I absolutely love. I love them for chemotherapy. I love them for post-surgery. For some patients, I love them for my dry mouth patients because this one is just MCT oil, beautiful high-grade coconut MCT oil. This is something people can use periodically throughout the day. They don't have to pull for 2 to 5 minutes. They can use it more kind of like chapstick. They would put it in their mouth and just rub it around and lubricate the area. And because it's just MCT coconut oil, they can swallow it. We don't recommend that people swallow if they're pulling pathogens for 2 to 5 minutes. But if they're using these that don't have tea tree or neem, they can actually just put a small amount in their mouth. I'm not a big fan of people swallowing a lot of anything besides food and water. But as these are oils that are, these specific ones here are just coconut oil and food grade peppermint, or sesame and food grade peppermint. And so again, this could be utilized for people with dry mouth or chemotherapy. That is my favorite part of the whole thing, because these oils are under $20 for patients to buy. And right now, there is studies showing lipid-based dry mouth products are superior to water-based. They stay longer, but we don't have a lot of lipid-based dry mouth products, and many of them are above $50. And this is under $20 for 8 ounces. So great thing for our patients to try, something to try. We're going to talk about some of our other things. We do have a water flosser, and I will just tell you that I love having patients use water flossers, but the key is they have to be, usually they have more complaints if they're using them in the shower. And so this is great because ours is waterproof. They can take it in the shower and they can use it. We have a children's and we have an adult's. We also have our new toothpaste that I'm so excited about. These do come in a 1 ounce, but we have our new sensitive. And I will tell you, this toothpaste is really a game changer. I love the consistency. It's brand new. It has nanohydroxyapatite, 5%. It also has L-arginine, Arginine is a precursor to nitric oxide, so that can actually help with inflammation. We also have xylitol. Xylitol stimulates saliva. It can help with caries prevention. And this, of course, has potassium nitrate. And again, nitrates break down into nitric oxide for with those pathogens, but potassium nitrate is especially used, formulated for sensitivity. But it can ask, this toothpaste can actually be used by anyone, and I love it. It is my absolute go-to favorite toothpaste right now. We do have our kiddo toothpaste right here. We have a toddler toothpaste and a kids. The kids toothpaste is new. It has strawberry mango and it is wonderful. Very affordable. All these toothpastes you can get on a retail site and see. I know Walmart carries some of them. I've seen this one as low as $7.99. Our kids toothpaste, I think, is around $5. But you know, every price is different, so you never know. But we have it affordable. This one is 25% xylitol. And so it does have hydroxyapatite too in it, but it's the micro. So this is a great toothpaste, fluoride free again, and your kiddos can use. And we have our tongue scrapers. The stainless steel is great for operatory. You can actually put that in the autoclave and then use it on a patient to show them where the candida or white coated tongue, which would be yeast. Yeast is causing cavities. We're starting to see yeast being a big problem and not just bacteria anymore. And so we can show the patient, hey, we need to be also using the tongue scraper or a tongue cleaner of some sort. We love the stainless steel one because they can use it, put it in the dishwasher, and you can autoclave it and have it at your chair side to show. Our toothbrushes are what we're known for. This has 8,000 bristles. This is the butter on gum toothbrush. It is ADA accepted. It's got a great price point, by the way. We are going to AAO this week, and there are specials on my Instagram. There is a link to it. If you're having problems reading, I think I'm going to put out another one with a better picture, but we have specials going on and we honor you're able to have those specials also. So anytime you guys are ready to order something, you can always email Lene, who I'll hook you with in an email. I'll connect you guys afterwards. And you can ask her, is there any show specials that we could take advantage of? And I'm going to tell you the AAO and the California CDA is coming up, and we have some good specials coming up, but they're temporary and only for a small time. So be thinking about that. But our toothbrushes are fabulous. We also have a kiddo toothbrush. This toothbrush has no BPAs. It's got, it's non-toxic. It's this Softex bristles. These toothbrushes are the only toothbrush a child should use, especially the first time you ever use it, or anybody in mixed dentition, meaning they have some teeth that are loose. They don't brush well because the toothbrushes, most of the junior brushes and pediatric brushes that we have currently are too hard. So this is a toothbrush that's just beautiful. I love this toothbrush. My grandbabies use it. By the way, the giraffe one can also be used as a bite block. So many of the offices buy it for a bite block because the kids can hold it while you're doing something that's soft. We have the ready-to-go toothbrushes. These are our new toothbrushes that are super soft and small. They're very compact. They're for TSA pre-approved. They have xylitol toothpaste. There's no fluoride in them, but they're pre-pasted. And it's safe to swallow because there's no fluoride. So they can utilize these. They're found at Walmart. You guys can have them also. Many offices are buying these for when patients come in and need to brush first, or they ask for a toothbrush before their procedure. We have 100% recycled plastic that we're using for these. So these are really fun. We love these, the ready to goes. We also have expandable floss. This floss comes in unflavored mint. It comes in vanilla and it comes in cinnamon. There's 10 yards, which is quite a bit for this. And it comes in 55 yards that you can purchase from our retail site also. So if that's something you guys are interested in doing, you can utilize the code that I'll give you afterwards. But I think retail wise, even at Walmart, people buy it. It's around $1 or just above or under, depending on what they're doing. But it's about 55 yards. But I like to use these, and you can just take a little bit off, floss your patient, then you give it to them after because there's 10 yards in there. There is no forever chemicals in this. There's no PFAs, and there's no allergen. We love this floss also because it expands only where you uh, kind of put it in interproximally, or you can pre-do it if you need to use it for silver diamine fluoride or curodont or something like that. You need to use it with a product that you need to go interproximally with. You can expand it prior and then utilize it that way. The super floss tends to, that floss has so much that it wastes the product, and sometimes it'll give the kids a little whiskers if they're having silver diamine fluoride. So people love our floss, and it's very, very affordable. We also have our concentrated mouthwash. This is for people who don't want a lot of plastics. They blend the 7 essential oils along with water, and there's 300 uses in this. And then we're going to talk a little bit about our mouthwashes. This one has a pH, this is our whitening, but it does have a low-grade hydrogen peroxide. And we know that hydrogen peroxide is really taking off in dentistry right now because its original use was for caries and perio. And so we know that peroxide helps with oxygenation. And so why could this help our patients? Absolutely. This could be a game changer for some people. We don't know. That's why we have to try these things. There's no fluoride in this, and it is pH neutralizing, and there will be there's obviously whitening also that comes with it, but the hydrogen peroxide could actually be used by people to benefit in other ways. So we're excited about this, and people really love it. It does come in I think this one comes in the 32 ounce also, and with a pump. So you guys can have it at chair side. Most of I think if you guys were at Yankee, I think Chicago was the first time we did our bar, our rinse bar. But anyway, all of our rinses now, we've gotten the bigger size, and you can get them at Walmart also, but we have them on our professional site with a pump, and then you can have them chair side if you want to utilize. Now, these two are my favorites. Well, one of them is the public's favorite, which is our breath harmonizer. That comes in a 3 ounce, and it also comes in the 16 ounce. I'm not sure if this one comes in a 30 ounce also. It may. But anyway, this one is got the sodium chloride. And so that's going to help with breath freshening. So this is, if you use it once a day, it's 12 hours of breath freshening ability. If you use it twice a day, it's 24 hours. And this is ADA accepted also for the breath freshening. And so it's, again, pH balanced, and this is a very, very popular rinse that most people like for that breath freshening. We also have the pink. I love this one. This is very unique. The Cancer Institutes came to us, and they were like, hey, we love your essential oils, but they're really too strong for people. Is there any way we could have a product that just doesn't have as much essential oils or flavor for people undergoing chemotherapy? And we took that on and made this beautiful rinse. It's called Vita Breath. And Vita Breath is basically a beautiful salt water rinse. There's no alcohol, there's no flavor agent, there's no sweetener. It is an amazing rinse for dentistry, for pre or post surgery or post procedure. This could be something you could utilize for people, and then they can purchase it on their own at Walmart or on our website. And so it comes in a pump too, if you want to do the 32 ounces with the pump. This is the go-to, I think, for the dental office for sure. We also have, and we have some other rinses. You're welcome to get on our professional site and see. In fact, I saw the other day, I think you can buy all of them and have them shipped. Like there's a pack of all of them. So you can look into that for sure. We have this kit is our oral care kit. It's only available for dental professionals. This one is not on the retail site. It does come with a stainless steel tongue scraper, our toothbrush, and the flosser. So it's everything you need along with the oil. So it's the whole kit, but you don't have to. You can separate the kit out. You can buy the kits. The kits are usually, I think for AAO, I think they're $1. So if you guys are interested in these, I mean, the stainless steel tongue scraper is $1. So you're getting everything else for free. And I tell people you can, unzip the bag and take things out and just hand them out individually if you guys are interested in buying those. The next 2 shows we should be running specials on those. We also have our ultrasonic pod cleaner. This California just passed that it's a $5,000 fine if you put a individual mouth guard or appliance in communal ultrasonic. So this is a fabulous one for individual. You can have it in your operatory. It has a stainless steel drum so that you can wipe it with a cavi wipe and put just individual, or you can put even a zip lock and put it individually in there. Then your patients can purchase these afterwards. You can carry them at your office and sell them, or they can purchase them at Walmart. We give, the professional, we try to give the best price. I've seen them at Walmart for, I think, $39.99, which is actually a fabulous price. So we're really excited to have that. We also have retainer cleaner, and this is a hydrogen peroxide base. So you can put it in the retainer. You wait about 5 minutes, and then you're going to rinse that off. It helps with the odors, and it helps with cleaning, and it's completely safe. So that's a great one to use for people that are doing, if you guys are doing Invisalign, or you have patients, or anybody wearing night guards and things like that. We also have our white strips, which I love. This is the last thing we're going to talk about. I saw the other day a sensitive, and I do not know anything about it yet. I leave for the conference tomorrow, so I should be hearing more about, but I saw that we're releasing a sensitive, but I will tell you, these are really low sensitivity anyway, because they have coconut oil. And again, we talked about hydrogen peroxide. These are a low dose, like a low percentage hydrogen peroxide. So there's a chance that someone could utilize these not just for whitening, but also to help with other dental bacteria. The strips really stay on. I love to just kind of dry my teeth a little bit with, clean washcloth, and then I just put them on. And I'm telling you, you have to like pull them off. They're really great. They're a very affordable price point. I think retail for your patients to buy, they're around $10. I think we run specials that sometimes you guys, dental offices can get them for like $5. I recommend giving these out to patients for special occasions than a coffee card or, candy or something. Is why not give them white strips? It's, just a great thing to be able to utilize. There's 14 strips, so you get 7 uppers, 7 lowers. So I have been wanting aloe vera in a product for 3 years that I've worked with GuruNanda. And they're like, Kristen, we finally got it. GuruNanda bought Natural Dentist. And we are really excited. This has 20% of purified aloe vera. Aloe vera is wonderful for wound healing, for epithelial, and for perio. So we're excited to have that. And I will tell you that Stimudent is also Natural Dentist. And Stimudents were going to go bye-bye, but we swooped in and bought the company, and we will keep Stimudents. So there's a big following behind that. We're excited to have Stimudents part of the GuruNanda team. So I wanted to thank you guys. If you guys have I tried to hurry as quick as possible through this. Do you guys have any questions at all? I also want you to take a picture real quick of the DP30. By the way, that is used only for dental professionals, and that's 30% off our retail site. So we ask you just to keep that for you as dental professionals to use. And then I will be connecting you with Lene in just a little bit in our email so that you guys can connect. Do you guys have any questions for me at all?
No, I think overall we liked most of the products. We're just trying to figure out
Okay.
which natural company we're trying to implant in the office right now.
I love it.
Yeah, we had
Okay.
dental herb last week, and you guys, and then we had Dr. Jazz. We're just trying to figure out what we like. So I think
Okay.
definitely the samples are important for us because we have to feel confident that we can recommend.
So what I would love you to do, because we have not sent your samples out, because we want to customize it. Can
Yes,
you send me an email
yes,
with what you're interested in? Since we
yes,
talked just now, you can go
yeah.
through our professional and retail site and just say, these are the top things that we are really considering. And then I will get a shipment out to you as soon as we can get that shipped out. So yeah, that's what we want to do. Is we would love to support you. Again, I believe that our product will support your patients in, and they then can get the product themselves also at an affordable price. And I think that's awesome. is something that people really need to be able to, hey, I can go to my dentist and buy it, and you guys can provide it if that's something you want to do. But then your patients can also get this at retail, which is important for them to get more access or to share it with other family members and things like that. So reach out to me anytime if you want more information on specific products, like from a hygienist point. But Lene is amazing, and she is our head of marketing, and she'll be the one that can really link you guys to figuring out if there's, like I said, we have 2 shows coming up. We would love to support you guys and give you our promos for that, and anything that we can do to help get GuruNanda into your patient's hands and support your, oral wellness program in your office. We'd love to.
Thank you.
You're welcome. You guys have a wonderful day.
Thanks.
Wait, Leah, are you saying something, Leah?
Do you have a question?
Oh, wait. Yeah, I can hear you now.
Oral appliances, like the machine itself is $39.99 for the cleaner.
Yes. Yeah. Are you talking about the pod? I can't hear her very well, but okay. Yeah. So the ortho pod that we have available, I went to my Walmart a couple of weeks ago, and it was $39.99 at my Walmart on the shelf. You guys, if you get on my website, my Instagram, Kristen Evans, it's 2 I's, it's Kristen with 2 I's, Evans, the PHRDH. I have on one of my posts is the GuruNanda thing for AAO. We're going to be in booth number 500 and in Florida. And there is a whole bunch of specials that we have going on for that. And I think the orthopod, because it's an ortho, I'm guaranteeing the orthopod we're going to have a special on it. I just don't remember what was on it, but yeah.
Thank you.
You're sure welcome. You guys have a wonderful day.
Thank you, too. Bye,
Bye-bye.
Leah.
Bye.
Bye, Leah.
Bye.
All right. Thank you,
Thank
Kristen.
you.
Yep, we'll see you guys. I'm trying to get out of here. Sorry, it's taken me a second.
No, you're good. We're doing the same thing. Have a great day.